In 1932, the United States government began an experiment on black men in Alabama. It lasted 40 years. 600 black men in Macon County, Alabama were recruited into what became known as the Tuskegee Experiment. The project was run by the United States Public Health Service, and it was operated near HBCU Tuskegee Institute. 399 of the men already had syphilis, 201 did not. The men were poor sharecroppers. Doctors told them that they were receiving treatment for something called bad blood. That was a common phrase used in the South for several illnesses. They were never told they had syphilis. The purpose of the project was to observe what happened when the disease progressed without treatment. Some doctors at the time claimed syphilis behaved differently in black bodies. That claim had never been proven, and the study did not compare black patients to white patients in any way. The government needed access to the local black community, so the work was tied to Tuskegee Institute. The school did not create the study, but its hospital facilities were used, and its reputation helped the government build trust with the local residents. A nurse named Eunice Rivers became the main contact with the participants, and she helped maintain that trust for decades. The men were not paid wages to participate. They received medical exams, meals on clinic days, transportation to appointments, and burial insurance worth about $50. For families who could not afford funerals, that burial payment mattered. Then medicine changed. By the early 1940s, penicillin had become the accepted cure for syphilis. The doctors running the study knew it worked, but they did not give the men the drug. Researchers also contacted local doctors and draft boards to prevent participants from receiving penicillin elsewhere. The study continued while the disease damaged bodies and families. Men lost their sight, they developed neurological problems and died. Wives were infected, children were born with congenital syphilis. It was terrible. At least 128 participants eventually died from the disease or related complications. The study continued until 1972, when a young public health investigator named Peter Buxton discovered the project while reviewing internal public health files. Buxton raised objections inside the agency more than once and was told the study would continue. After years of trying to stop it internally, he took the information to reporters. The Associated Press published the story, and the country learned what had been happening for 40 years. Public outrage followed. The survivors and their families filed a lawsuit against the federal government. In 1973, the government agreed to a settlement worth about $10 million. Living men who had syphilis received about $37,000 each. Men in the control group received about $16,000. Widows and heirs received smaller payments. The settlement also guaranteed lifetime medical care for surviving participants and their families. In 1997, President Bill Clinton issued a formal apology on behalf of the United States government. By then, only 8 of the original men were still alive. For many Black Americans, the lesson had already been learned. The government had watched men suffer from a curable disease for decades. That history did not disappear. Medical mistrust within the Black community did not come out of nowhere. It came from experience.